We'll just give it a couple more minutes for people to join.
I think you'll just start when you're ready, Tim, and then we'll send the recording out if someone pops in late and want to see it from the start.
Okay, no worries. Are you starting the recording?
Yes, I have.
Yeah, you have. Great. Okay, that's great. So welcome everyone. So my name is Tim East. I work for an organisation called Health Innovation Yorkshire and Humber. So that's the logo at the top of the screen. And I look after our accelerator programs and our international work. Today you're on a session covering the Nordic Propel Bootcamp. So we're going to be running through that. On the top right, you see Propel at YH. That's just our branding of our accelerator programs. So I think Nana was just going to give a couple of words just as an introduction.
Yes, thank you, Tim. And hi, everyone. My name is Nana. I'm from Danish Life Science Cluster. And on behalf of the Nordic partners behind the program, I just wanted to welcome you all to this introductory webinar about the bootcamp. So Danish Life Science Cluster is one of the partners behind the program, and the other Nordic partners are Norway Health Tech, where we have Therese Oppegaard also having joined this call, and we have Business Region Gothenburg, where we have Iris Ørn as a representative. We have Svekær, where we have Anna Riby also on the call today. And we have Business Tampere, where we have Ilona Raitakai as a representative. So we are all the Nordic partners who will be supporting you in the application period of this program, and as well during the boot camp and before and after with supporting you guys. And as Tim said, from the British side, we have Health Innovation Yorkshire and Humber, who is the partner planning the program for you guys. And everything is supported by Nordic Innovation, who is funding the program. And this is the third time that we are now as a Nordic consortium doing this boot camp, and we are really happy to do it again. We have seen in the previous years that it's really creating a lot of value for the participating companies, and we look forward to bringing 10 new Nordic companies to Leeds in September this year, and hopefully some of you guys will be joining us for that one. Yeah, I think that was it from us, Tim.
That's great. Okay, so in terms of the agenda, we've done the welcome. We're going to touch on we're going to go into the detail of the actual boot camp. So what is it? Why would you attend? What's the value you're going to get from it? Who's involved? So we'll do a deep dive on that. This year we've invested in an online platform called Propel Connect, and you'll get access to that before you come over. So that means you will be able to connect with the mentors and the partners on the program, but also view the content. And we're really pleased that we've got a couple of our partners who help deliver the program. So Dr. Richard Evans from Leeds Teaching Hospital Trust Innovation Pop-Up is going to talk about how they support innovation into their local hospitals. And we've got Nathan from Nexus, which is the business incubator building that supports innovation in the region, and that's where the program's based. So we'll be covering those off. We've got time for questions and answers. The session's been recorded, so we'll be able to share the recording as well if you want to view it. Okay, this is just a slide from the Health Innovation Yorkshire and Humber's website. I think the key message with this is, so we're a government organisation funded by the Office of Life Science. Our remit is to work, so if you look at the bottom, we work with healthcare providers, which is the NHS. We work with innovators, so the people on this call, and we work with universities to show the evidence and the value of technology. So our remit is to work across those three sectors to support the adoption of high quality, high potential innovation into the NHS. So the actual, we're not alone. There's another 14 health innovation networks across the region. We are Yorkshire and Humber, but we also work at a national level. So where technology is working in one area, we'll spread that into other regions as well. So we do have a national spread, and we are all commissioned, as I say, by the Office of Life Science. In terms of our region, if you looked at the UK and put a pin in the middle of it, that's basically roughly where Leeds is, one of the main cities. Our region is Yorkshire and Humber, so it's the lighter areas here, these three areas. In terms of population, we've got over 5 million citizens. The funding that comes down from government into our healthcare system is over 12 billion. We have a whole range of NHS organisations, so different areas of the NHS. So we have 22 acute trusts, which are basically hospitals or groups of hospitals. 6 of them are teaching hospitals, so they bring the incoming doctors, nurses, and train them up. Leeds Teaching Hospital Trust is one of those. We have a number of mental health trusts, so that they're responsible for supporting patients with mental health needs. And then we have 15 what are called primary care networks. So these are groups of general practitioners, so more at a locality basis, and over 700 GP practices. So these, again, are there to support patients and citizens at a local level. The region's cut into 3 what are called integrated care systems. So that's like an umbrella organisation that works across all these areas in the NHS. And then we have a large number of care homes, 12 universities in our region, and a real hotbed for life science companies, especially in the West Yorkshire region. So that's a snapshot of our region. It's really a country within itself. It has its challenges. So we have pockets and areas of deprivation. We have pockets of wealth, and we have a wide range of sort of population and population demographics. So if you can get technology working in our region, then you've got a good chance of it working in different regions. Just a quick one in terms of our specific region. So the program's based out of Leeds. We cover West Yorkshire as well. So Leeds is a hotbed for health tech, and it has been for a number of years. So it has a large number of NHS organisations, it has a large number of health and life science organisations, medtech companies, and it employs a lot of people within the ecosystem. There's a lot of government agencies, which, shall we say, is in flux at the moment. So you have some of the key national organisations such as NHS England, health and care organisations that are actually based in Leeds as well. Okay, so I'm going to go through the bootcamp details. So this should answer the questions in terms of what it is, why you should attend. So why have we put the bootcamp in place? So basically entering any new market can be timely, it can be costly as well. The NHS is a very complex market. Although you see one brand as the NHS, actually when you get under the skin of it, it's many organisations working either individual or together. So we demystify that route to the healthcare suppliers. So how do you enter the NHS market? What are the important things that you need to do? So we demystify that route to market. And in terms of benefits, so again, this can be costly in terms of your research of understanding a market, how to enter it, how to engage with it, how to sell into it. So through our program, because we're doing this over a short period of time, in theory, it's timely. So within a week, we'll get a good understanding of how to enter it, how to engage with it, and have partners that will support you with that. So yeah, we save you time and money, although there is an outlay initially. Actually, the value you get through the depth of the program within a short period of time makes your route to market faster. I've worked in health tech for 20 years now. I've delivered technology into the NHS, and the team have similar experiences. The partners also deliver technology into the NHS or support that. So we're ideally placed to help you navigate that network as well. So that should give you confidence in terms of, you know, why you would come on the program. As I say, we've delivered it 2 times for Nordic Innovators and another 5 times for other regions as well. So we provide content. So a lot of it is learning. So making sure that you're fully up to speed in terms of what you need to know. We have a range of supporting partners. We have got routes into the system through the innovation hubs and our colleagues. We link you into the local ecosystem, and also we provide aftercare support as well. So it's a full package of program. So what it entails at a high level. So we've basically got 3 days of masterclasses that are facilitated by knowledge experts, partners, or the NHS. So that's key to getting your knowledge up in terms of how you're going to engage with it. We've got a day of networking. So that's one-to-one time with delivery partners, NHS stakeholders and key stakeholders. And we have a site visit on the final day as well, on the Thursday. On the Wednesday. We provide after bootcamp support. So we'll have a follow-up call depending on what your plans are. We provide all the materials, all the content, venues, refreshments, and we give you access to the Propel Connect platform, which I'll talk about shortly. So we bring the best of breed partners to the program. So they cover the whole sort of spectrum of what you need to know. So partners that cover things such as finance and funding, physical space, evidence, sales, growth. So we've got a good range of partners that will be there to support you during the program, but also after the program as well. Nathan's going to talk about Nexus, so I'm not going to touch on this too much, but this is the building where the program's based out of. So I'll leave Nathan to give you a good explanation of what that is and the value it brings. Okay, this is on one page, the process, the innovation pathway. So obviously you guys have already got a product or in your market, which will have, you've grown into your market. So we'll be overlaying this innovation pathway, which is a route into the NHS market. If you've done things like evidence and evaluation within your home territory, that'll hold water. So we'll be overlaying what you've achieved so far, bringing it into how that would work into the UK. So that's a snapshot of, moving your product into the NHS. Not expecting you to see the detail because there's a lot of detail in this, but we'll cover this. These are the 5 pillars of the program. So making sure you understand the NHS at a national level, moving down to a local level, how to engage with it, what to do from a legal perspective. So employing people, dealing with patient data, intellectual property rights. We'll be covering that. How you can fund yourself, either private investment or through grant funding, and access the funding landscape. Networking is a key part of it. So getting you linked into the local ecosystem, support through ourselves or partners. And then the important things that you're going to need to do, such as governance, clinical safety, how you move through the innovation pathway, applying for grants, and how do you show evidence in your product so that you can build a business case for the product to be sold into the NHS. So they're the 5 pillars of the program that the masterclasses are based on. So what we're looking at here is on the left-hand side. So we've got yourselves. You may have done some networking within the UK. You may have some contacts. You may have got a bit of a knowledge in terms of the NHS and how it works. Compared to a UK innovator, which are already in the market, they'll have an increased knowledge. They'll have a bigger network, more contacts, just simply because they're doing it day in, day out. So the boot camp is the blue section, really, to bring you on a par with a UK innovator, so that then you can actively engage with the market. it is a real competitive market, but if you can get traction in it, then there's a lot of value of entering that market. So if you're looking at priorities, so the NHS goes through a constant cycle of change, like any organisation. You may be asking what the priorities are at the moment. You've got multiple layers of priorities. So if you speak to the Secretary of State for Health and Social Care, Wes Streeting, these are the top 3 priorities coming from government. So from hospital to community care, from treating disease to preventing it, and going from analog to digital. So these are called the 3 shifts. So this is at a high level, the strategic direction of the NHS. Obviously, when you start going down the stream and getting more localized, then the priorities may shift or change. But these are the 3 shifts which are coming down from the NHS government as priorities. Along with this, there's going to be a 10-year health plan, which will be released this summer. So at the moment, they are just engaging with key stakeholders, the NHS, citizens, to understand, what are the difficulties, what do we need to change, how are we going to go about changing that. So some of the key things from the public is difficulty getting appointments, long wait times in A&E, lack of joined up care. So this will give you a flavour of what the NHS is looking at and the direction it's going in. You need to start thinking about how does your product fulfill these items or one of these items and aligning it to it. So this is very much at a high level. As I said, there will be the 10-year health plan, which will go into more detail. And then there will be an expectation that this will flow down to a locality for integrated care system level. And there will be there'll be projects to help deliver this. So again, it's aligning what you're doing to what's being asked. Okay, so as Nana mentioned, we've delivered the program twice now. This is one example of an innovator, Television, who attended the bootcamp last year. So attended the bootcamp, took residency up in Nexus. They worked with the Integrated Care Board on an opportunity. They were successful with getting their product commissioned across the Integrated Care Board, across Leeds. They got investment and funding, and they are currently deploying their product into the Integrated Care Board. It started off within a smaller cohort, and it's expanded out. And they've worked closely with a range of our partners with this as well. So this is just one example. We've got other case studies, and I'm sure they'll be happy for you to reach out to them if you want to. Okay, so going into the detail of the program. So what we'll be doing is we'll be running a couple of online sessions before you come over. So we're going to be covering off the NHS landscape, which will be broad brushstroke and then deep dive into what does the NHS landscape look like. And then these are early September, and the following week we'll be running through that innovation pathway. So you can understand your route, how you're going to navigate along that innovation pathway. So there'll be 2 online sessions that we'll record. And then you'll come over the week of the 22nd of September. So this is the sessions that we'll be covering. So we'll be covering welcome, introduction to the program. We've got a partner called Quiddity that is their day job to support innovators with their route into the NHS. So they'll be covering how do you enter it, what are the key aspects you need to consider. Then we've got a session with a partner called Medipex. They'll be covering off NHS funding and further entry guidance for the NHS. And then in the afternoon, we'll be covering off how to communicate with the NHS, how do you do marketing, how do you communicate, and what are the key messages that you need to bring to life. Moving on to Tuesday, we'll be introducing you to our regional government partners, so the West Yorkshire Combined Authority, who supports innovators. We'll introduce you to Nexus, who you're going to meet today. We'll be covering off evidence and evaluation, which is basically how do you show the value that your technology brings to the NHS. And then we'll be covering off clinical safety. So clinical safety is really important. Before you even deploy anything, they'll expect you to have got your clinical safety in a good shape, and something called DTAC, which is Digital Technology Assessment Criteria. It's nothing too taxing. It's stuff that you should be doing, but you need to be aware of these things. Moving on to Wednesday, we'll be spending time with Hill Dickinson covering the legal aspect. We've got Power Equity, which is an investment firm, running through how, if you was thinking of raising investment, how you would go about that in the UK. And then we'll introduce you to the Innovation Pop-Up, which is the local hospital, and we're going to meet the Integrated Care Board, who is a commissioner for the region. So that's the Wednesday. The Thursday is not going to be masterclasses. It's going to be innovation showcase. So the partners will be there. We'll get stakeholders to that event. Opportunity for you to just describe your technology and the value it brings. We'll have a round table, opportunity for further questions and answers. And then in the afternoon, we have all the partners there. And that's an opportunity for one-to-one discussions and conversations. So that's the Thursday. The Friday, we'll wrap the program up in the morning. We will be available from mid-morning in the afternoon if you want a one-to-one with the health innovation team, just to wrap any further questions or to get an understanding of what your plans are moving forward. What I haven't covered on there is some evening events on the Tuesday. On the Thursday, there will be a networking meal as well with the partners. So there will be some social aspect of it. We don't expect you to be working all the time. But it is an extensive agenda. There's a lot to cover. It can get quite tiring, but the purpose of it is to, within a week, get you to a position where you clearly understand how do you move forward in the UK NHS market. We have plenty of breaks and lots of coffee, so keep it watered and fed. In terms of logistics, so there you can fly into Leeds, Bradford or Manchester. So Manchester's only an hour away. London's 2 hours on train, and there's fairly good links there. In terms of accommodation, Leeds City Centre is all walkable. So if you get accommodation in Leeds City Centre, so Nexus, Hill Dickinson, the local hospital are all within walking distance. And we've got a list of venues and hotels which are within the region. So yeah, after the boot camp, we will organise a follow-up call to get an understanding of where you are. So it'll either be boot camp was great, we're on pause, or we're going to go for it. What would you suggest? How do you move forward? And we'll put in place a level of support depending on what your plans are for the future. So again, reverting back to Pelivision, when they landed, we kept in touch with them. We provided a signposting service. We've done a couple of case studies with them. So we just forged that relationship with that innovator and help them as things move forward. Okay, this just sets out the responsibilities. So I think Tree's going to cover off the payment for attending the boot camp, which is 50% funded. You'd need to fund your travel, your accommodation, any evening activities outside the programme. From our side, we provide all the venues, we provide all the daily refreshments, we provide all the partners, we provide the networking meal. So yeah, if you've got any questions on the actual details of this, we're happy to take these. Okay, so how does it work in terms of applications? So applications will open today. Any interested innovators can apply through a simple Microsoft form. And we'll put the link in the chat. We'll review it, we'll provide feedback, and once accepted, Trees and a team are going to deal with any payments. We'll give you access to the Propel Connect platform, so that'll be late August, and we'll provide a further briefing session in September. We have a marketing person, so they will start sending marketing comms out through our channels to tell people that this is happening and drum up interest as well. This is the Propel Connect platform that we're currently investing in. So what you'll get access to this platform. So it's website, iOS or Android app. All the partners will be on here. You'll be able to connect with them. You'll be able to see their organisation, how they'll support you. We will put all the content onto this platform, so you'll be able to browse that. We'll put all the events, all the masterclasses will be on here, so you'll understand what's being covered, who's covering it, what you'll get out of that session. So yeah, you'll get access to content and the full program online beforehand. You can import the events into your calendar, and you'll see all the partners on there. So we're currently going through a build with this with a design agency, but it should be in place for you sort of mid-August. And we won't take access away. You'll get this moving forward as well, so even after the program. Okay, so I've done quite a lot of talking. I'm going to pass over to Dr. Richard Evans, who's going to talk about how they support innovation within the local trust. Richard, do you want to take control? I think there might be an option at the top to take control.
Oh, yes. Yeah, thank you, Tim. Yeah, I've just seen that. I was wondering how that was going to work, right? So I can just click on the slide to go through that. That's perfect. Okay. Can everyone see? Of course, you can see the slides. That's perfect. And you can see me. So thank you very much. And for inviting me, Tim, to be part of the session today. Really pleased to be here supporting the Nordic Propel boot camp. So everyone, I'm Richard Evans, Head of Business Development and Innovation within the Research and Innovation Department here at Leeds Teaching Hospitals Trust. And hopefully over the next 10 minutes or so, just give you a brief flavour of the support available to companies through research and innovation within Leeds Teaching Hospitals and our infrastructure that exists across the trust to support that activity. Okay. Are they moving forward okay? Perfect, thank you. So first of all, to say we're one of the largest teaching hospitals in Europe. And this slide just gives you a bit of a flavour into some of the sort of metrics surrounding our organisation. So we have 2,000 beds spread across seven hospitals in the trust, and they're based at 5 sites across the city, employing over 22,000 staff. So that number increases, and we treat over 1.6 million patients a year, providing a range of specialised services from the teaching hospital on a local, regional and national basis. Tim has already sort of gone into some of this, but just I thought it'd be useful showing a slide around Leeds. In fact, we're based in one of the fastest growing cities in the UK, home to more than 3,000 digital and data companies, top UK city for business startups, one healthcare and system operating across the city, very much an integrated fashion, and part of the West Yorkshire Health Tech Investment Zone, which I suppose gives good reason to why we're a great place to land as an international company. And it's that investment coming into the region that I just wanted to highlight some exciting developments going on across Leeds at the moment, in that we're creating an innovation village right at the heart of the NHS, right at the heart of our Leeds General Infirmary site, which is our main site based in the city, where you'll visit later on in September this year. And we're very pleased to welcome you to the trust. This vision is centred around a couple of, in particular, new exciting developments, which is a new hospital development and also the redevelopment of our old medical school, which is going to be refurbished to create a brand new innovation hub, again, right at the heart of the NHS site in the city of Leeds. So just to give you a sort of brief sort of background on some of this. So the new hospital development is part of the government's new hospital programme. We've been allocated as wave 2 in that, so this development has actually been pushed back a little bit now. Some of you might be aware of this was very much ever present over the past couple of years, but we've been pushed back into wave 2, obviously trying to bring that forward as quickly as we can, but it's likely that that will start around 2030 to 2035. So it's still some years away, but it's very much at the heart of some of the innovation developments going on as part of the city. So that new development would be a new adults hospital, a new home for the Leeds Children's Hospital, and also creating the UK's largest single-site maternity and neonatal centre. So you can see a picture of the development there. It's 18 floors, 600 beds. So a massive development, improving healthcare across the city to come in the next decade. So like I said, and though this won't launch until 2030, 35, meanwhile, we have our exciting new medical school development that you see in the image here. This is proceeding, and this building has now been handed over to a developer called Scarborough Group International, who will start actually on site in September of this year, and will refurbish the old medical school to be completed in September 2027, so development over the next couple of years. And this will create an exciting new innovation centre, very much focused around business, setting up in the region with co-working spaces, meeting rooms, event spaces, offices, labs for startups, industry of all different shapes and sizes, also for academia, government, and community organisations. So, and this is very much a partnership with others in the region, including Nexus, who you'll hear from Nathan shortly, creating around 75,000 square foot of innovation space in the city and delivering a whole range of impressive economic outputs at the same time. So including 500 new homes, 4,000 jobs. So we're really keen to showcase this to international companies and connect them to this exciting development going on across the region. So just a couple of images, I suppose, of the development. I won't linger on these. There's a great video. Perhaps we can share this with you after the call as well, so you can watch. It brings that sort of new development to life somewhat. Oh, it's probably started playing that. So as one step towards these new developments, a few years ago, we created the Innovation Pop-Up, which is very much our front door to innovation development within the organisation. The pop-up aims to, and you see some of the aims on the slide here, to support the development of an innovation culture within the organisation, very much act as a platform for health tech innovation and our front door for businesses to engage with innovation activity within the organisation. It's an actual physical space that we've created at the Leeds General Infirmary, just a short hop away from where the new Innovation Hub will be. And it's a space where our staff can work collaboratively with businesses, both on a local, regional and international basis, and others involved in innovation to really sort of support companies developing new products and new innovations and connecting them to the innovation into the NHS. So it's very much acts, and we hope it will act now and in the future as a test bed for the evaluation and piloting of new medical technologies, and also supporting some of those local economic growth and hopefully sort of addressing some of the barriers to innovation adoption in the NHS. So again, in September, we'll be very pleased to welcome you to the facility. Sort of moving on. This is just a little bit of a visual of what the Innovation Pop-Up looks like. I know some of you have already visited that before. It provides both support to our staff in things like providing innovation training, supporting staff develop their ideas and providing advice towards intellectual property, for example. We run a whole range of engagement events to introduce new innovations across particular emerging technology themes like artificial intelligence, augmented reality, new digital technologies, 3D printing and planning, and new therapeutics and things like that. Providing support for developing projects and collaborations with business, and very much connecting to a wider network of partners, which is why we're particularly keen to be a partner in the Propel program. So support is provided through the pop-up by a growing business development and innovation team. And this is very much sort of aimed at that aim of developing the culture of innovation within the organization to provide a better environment, I suppose, for innovation activity and new innovation research and adoption. Importantly, the pop-up also provides support to businesses. Quite a busy slide there, but just to highlight a few, I suppose, we can provide a better understanding of unmet needs within, obviously, a very large healthcare provider, and we have a whole range of different clinical service units. Most of the different specialities and therapeutic areas are covered across the trust. We can support engagement with patients and the public to support research and innovation projects, and we have a dedicated PPIE team who provides support in that manner. We can support collaboration for the validation of new technologies, including things like new surgical technologies through our Health Tech Research Centre, and also the development of new in vitro diagnostic methods and products. Really interestingly, actually quite uniquely at the moment, we can provide access to real-world data sets for the training and development of artificial intelligence algorithms through a particular research-focused data team that sits within the Research and Innovation Department, as well as providing training in clinical research for our staff and businesses. We can also support the wide range of delivery of clinical trials, providing evidence and evaluation of a range of different technologies. And that's developed through our NIHR-funded research infrastructure. We provide support to companies through a membership subscription model, offering companies support in connecting into the NHS, raising awareness of their products and innovations through networking opportunities and product demonstration events, space for companies to work in Leeds, and that's very much on that trajectory towards that new innovation hub being developed in the city, as well as a range of other project support, and some of which I've highlighted before, like access to patients to support access to data to support the development of new technologies. And this is all based on a sort of small subscription model dependent upon company size, small, medium and large companies. And we're very much keen to be developing a sort of range of community, if you like, of companies very much based towards that new innovation hub development coming down the line. This next slide shows a few companies who are part of our membership community. That's growing and has reached over 50 companies now. And I suppose importantly to say, we have a range of Nordic companies who are part of our membership, including the likes of DMV and Martis, Holocare, Ladidi, and we're actively supporting some pilot projects and research projects, actually some quite large-scale projects involving partners and companies from the Nordics. Briefly, before I finish, just wanted to sort of highlight, I suppose, our track record in supporting international activity with a range of different SMEs across a range of different companies that you see there, helping play our part, I suppose, in bringing new innovative technologies to the UK and supporting international companies to land in Leeds, and particularly connecting them to our research and innovation infrastructure that exists in the trust. Very much a partnership exercise, working with the likes of Nexus, the universities across the region, and the likes of the Health Innovation Network. So again, really pleased to be part of the Propel program as a partner. We've had particularly strong activity with Spain, Israel, and previously with the Nordics, and I was really pleased back in 2023 we actually held an event in Leeds called Growing Leeds Norway Health Tech Partnerships, where we invited a number of companies across, again working with the Health Innovation Network and partners across the city, which actually led to a number of the Nordic companies becoming our members. So finally, why work with Leeds Teaching Hospitals Trust? I suppose I just wanted to highlight that a big reason for that is in the UK, we are a research delivery powerhouse. And this next slide gives a bit of a feel for some of our sort of performance highlights, if you like, around research and innovation across the city. We're a top 5 recruiter to research funded trials in each of the last 5 years. We were one of the top acute trusts in England for recruiting patients into trials in the last financial year. Since 2020, we're actually the top trust in England for recruiting patients into industry-sponsored research studies. And across the last 5 years, we've actually recruited over 100,000 patients to research across the trust, and have over 1,300 live clinical research projects being conducted at any one time. And a lot of this is occurring through the funding that we receive from the National Institute for Health and Social Care Research to support a wide range of infrastructure that we have in place across Leeds. And I know I'm short for time, so I won't go through all of these, but perhaps just to highlight a couple. The first one there, we have a clinical research facility funded by the NIHR, supporting the delivery of early phase evaluations of particularly new therapeutics, advanced therapies, pharmaceuticals, vaccines, and medical devices. And we're really particularly keen to plug international companies into that infrastructure. Perhaps just to highlight, we're also part of a nationally funded, NHS England funded for now, program called the National Clinical Entrepreneur Program, or Insights, and that's 18 sites across the NHS supporting the streamlining of adoption of new technologies into the NHS. And perhaps just last to highlight, you can see the range of other sort of NIHR infrastructure that we host: our Biomedical Research Centre, Health Tech Research Centre, which is particularly focused around development of new surgical technologies. We're also lead for something called the National Pathology Imaging Cooperative, which is an initiative that's building and deploying digital pathology across the region and on a national basis, and in doing so helping to sort of stimulate research into the evaluation of AI technologies across digital pathology as well. So you'll see a whole range of infrastructure which we're particularly keen to raise awareness amongst our international companies and plug you into. So I'll close there, Tim, if that's okay, and just look forward to seeing companies and partners in Leeds and hosting you at the Innovation Pop-Up in September. So thank you.
That's great. Thank you, Richard. So yeah, deep dive. Hopefully you've got a good understanding of the pop-up and how you'll meet them and support you. Okay, that's great. So I'll take control, and moving on. Really pleased to have Nathan, who represents Nexus, who's going to give you an insight into their offering.
Hello, shall I take control now, Tim?
Yeah, you can take control.
That's dangerous. Just hello, everyone. As the eagle-eyed amongst you might have noticed, I am definitely not Sophie Quayle. She is one of my colleagues, and is responsible for this slide deck. firstly, we're always happy to support the Nordics in this. My colleague Barry, who would normally be doing this, is actually in Denmark at the moment at the health tech accelerator. So he's over there, which is why you're stuck with me. I'm the head of collaboration and health tech lead for Nexus. So my role is to support any companies dependent on, regardless of sector that they're in, within Nexus, to help them access the expertise we have, not just within the University of Leeds, which is our primary role. I'm employed by the university, but also within the region. So I'll start by explaining a little bit about what Nexus is. So Nexus is based at the University of Leeds. It sits at the south end of our campus, about 100 meters, if that, from the Leeds Teaching Hospital. So we're very close proximity to that. We were set up to be a hub within the university for companies who weren't spinning out but were wanting to come and work with the university to access the strengths and the capabilities and the expertise that we have, not just as I say, within the university, but as the building has matured over the last 5-6 years, we've focused more on the regional strengths as well. So in its physical form, it's a £40 million investment for an innovation hub. We don't say we're an incubator. We don't have a cap on the length of time that people can be a member of the building. We're about creating a real community here. So we've got companies that have been here from day one, and now they support the companies that have been here a shorter period of time, the new members, using their experience, especially within the health tech cluster, which I'm responsible for, to really drive it forward. Another richness is by not being specifically on health tech, a health incubator, we can bring in the expertise and connections into other sections as well. So we have our other main cluster is smart city. So looking at data, digital twins within the city, using Nexus as a test bed as well to support technologies to move through that cluster, and the sharing of expertise between our clusters as well. Moving on, sorry, I pressed the wrong button there. So these are just some visualizations of what the space looks like. It's quite a modern building. As I say, it's only 6 years old this year. We had our 5th anniversary last year, which was very great, and we brought together a lot of the companies who have been past members and our current members. And it's really to create spaces where people can collaborate and work together. So we have an event space on our ground floor, which has a lecture theatre, seminar rooms, and also a lot of soft seating and collaboration workspace, which means that we have a lot of opportunity for contact between companies. Also meeting spaces, bringing academics in, bringing clinicians in the health space to have those in-passing conversations. One of the best examples of how conversations like this can occur is actually one of our members. Before it got set up, he heard our then director talking about the building and in a coffee shop, and came over and said, I want to be a member of this building when it opens. So we understand the power of those in-passing conversations and what they can do to support. So where do we sit? We see ourselves as sat really in the center of everything that's going on. We're a bit agnostic in that respect. Whilst I'm employed by the University of Leeds, I don't believe that we succeed unless the companies within our community succeed. So if we can't deliver through the University of Leeds, we look to other partners in the health space, especially, to deliver on that. But by being agnostic, we can also really work with the company to understand what you're doing, how you could impact, and whether as well, to be quite frank, if there's a need for your technology in the NHS, because there's no point you spending time looking at the market access or wanting to come to the UK if we can give advice very quickly that either your technology won't be adequate or won't meet a need, or maybe you need to direct it in a slightly different direction than you were thinking in order to access the UK. One thing Tim mentioned previously is the demographic, the what we have as a region. I think it'd be remiss to say that one of the challenges we face in the region is that when we look at deprivation and the social outcomes and health within that, 22% of West Yorkshire sits within the 10% most deprived. So that means we've got a population with a lot of health challenges. And when you're looking at what Tim mentioned about the shift from treatment to prevention, those are the populations which are going to need to be targeted by whatever government we have in the next 5, 10, 20 years in order to make those big changes to health outcomes in the UK. The common conditions in those populations are respiratory, cardiovascular disease, mental health. So across a whole range of conditions and chronic diseases as well, which makes those conditions a real target for us, and in terms of looking at what companies can do. So we take that really agnostic approach in terms of if we need to work with primary care, we will work with primary care. As I've said, we've got Leeds Teaching Hospitals and the innovation pop-up and all the infrastructure that's been mentioned by Richard. A lot of it's great that it's joined as well. It makes my job a lot easier because the NIHR infrastructure shared between the university and the trust means that we have very good connections with the trust, but we have also got that civic remit as a university for the whole of West Yorkshire. So we work with the mental health trusts, we work with community trust, primary care, a lot of contact with the Health Innovation Network and the Integrated Care Board and their joint innovation hub to understand where we can really support companies coming through. So this slide kind of brings it all together into the fact that we are that connector. How do we connect into the university? We have the academic expertise, but more importantly, really for me, is the ecosystem connections and the access to the facilities. A lot of places have academic expertise. It's how we work with the business to really understand the needs, and then how we connect with the correct academic expertise, but also the partnerships we have in the city, in the region, to really ensure that we're giving the best possible support for a company. It could be that you come in looking for research connections, but after a year, maybe 18 months, you've got that research up and running, and now you're looking at growing the business. How do we support you in different phases of your business cycle? That's something we've expanded into. So looking at internships, graduate projects, or actual graduate recruitment as well, should you find the UK as a market you really want to grow your footprint in. As I've mentioned, we really view Nexus as a community. We hold events quite regularly to bring the community together. Last week we had 2 events on the same day, one focused on medtech regulation and medical regulation. That's our Nexus Connect event, which is held 3 or 4 times a year to bring experts from outside the university in, and also to provide a space where our members can come together. And on the same day, we ran a Connecting Health Innovators event where we brought together the membership to just have a few cups of coffee and cookies and get to meet each other and understand what was going on there and between the businesses. And then finally, like Richard, I've got a slide which shows some of our members as well. This isn't just the health members, but there are some health members on there. Some you might recognise. Ladidi, for example. We've also got a couple of others. Palevision are one of our members as well, so we're supporting them. And also Smart Crowding as well are another member from the Nordics. So we've got a few from the Nordics, but we're always happy to support more in terms of their access. When we set up, we were focused on membership of the building. Now, in the last few years, we've really looked beyond that to what we have a community which includes resident and non-resident. So you don't need to take the physical space in the building to get access to our team and our support. But I'll leave it there with the final slide, which has Barry's details on, just to cause more confusion. I apologise for that, but Barry is really the key point of contact for anything Nordic for us. He's, as I say, he's already out there in Denmark. He's been to Oslo Science Park as well a couple of years ago, so he's really keen on exploring those connections and how we can work more closely with you.
That's great. Thank you, Nathan. And thank you, Richard, for your presentations. Okay, so I suppose you're asking, what's it going to cost? So, Teresa, do you want to cover off this bit?
Yeah. Thank you for some good and in-depth presentation so far. I hope the companies participating are getting an interest to learn more about this program. So the original participation fee to attend this program is actually £5,000, which I can only convert into Norwegian kroners, I think right now, but it's about 70,000 Norwegian kroners for the whole week. But what we have been able to do is to have some support from Nordic Innovation. They fund this project and they fund the work that the Nordic partners do into this, and they also co-fund the participation fee for the companies who want to take part in this. So they, together with us, can co-fund 50% of that participation fee, meaning that the real participation fee for you guys would be £2,500 per company. Which will be invoiced to you from us in Norwegian kroners, I think. Yeah, so to speak. So, and just for you to be aware of, I don't think it's going to be a problem for any of you. It hasn't been a problem for any company so far, but this financial support is provided as what they call de minimis funding, which means that there is a cap for that de minimis funding over a period of three years on 300,000 euros. So if you have any question regarding that, we can take that in a separate call with one of the partners or with me afterwards. So yeah, I think that's it for now. So the participation fee, £2,500 invoiced to you in Norwegian kroners, just for you to be aware of that. So yeah.
That's great. Okay, that brings us to the end of the presentation. So if anyone has any questions you want to ask, feel free to unmic yourself and ask the question or put it in the chat. In terms of next steps, so we've put the link in for the form to apply. We're going to keep applications open over the next few months, but the earlier you get in, the faster you'll get your space secured, and the faster we can work with you to prepare you for the program. As I say, we'll keep applications open for a period of time. We'll give you some feedback, so we'll give you some intelligence on your organisation and your fit for the NHS. So we'll provide that anyway, and yeah, we'll give you a very fast, hopefully yes, once you've applied, and then we'll put in place the briefing sessions and give you access to the platform. So is there any questions? Anyone got any questions? Let me drop the sharing down so that disappears. Obviously,
Tim, could you maybe just also, because we have been focusing a lot on hospital and solutions for that sector, but just to underline that we are also able to include companies with focusing more on social care and elderly care, and etc.
Yes, yeah, that's fine. Yeah, so we have access into primary care and social care through our innovation hub, which works with the local integrated care board, and we'll be aiming to bring the integrated care board along to the sessions as well. So yeah, we do have inroads, so don't worry if it seems quite trust-based or hospital-based. We cover the whole breadth of it. Nathan, you got your hand up.
Yeah, just to add to that as well, we've got within Leeds, we have the Leeds Health and Social Care Hub, which is a Department for Health and Social Care and Leeds City Council joint project to support the link between the health service and the social care services. So we're aware of that. We work with them, and so any companies that are coming through will be able to support with Tim that access to people in those roles as well.
Okay, we might have blindsided people with so much information. So yeah, there's quite a lot to take in. As I say, if you've got any follow-on questions, feel free to reach out to myself or Nana or Trees. And yeah, we'll share the recording we'll send you the link to the application. As I say, if you've got any follow-on questions, feel free to reach out to us. So we'll bring it to a close there. I'd like to thank Richard and Nathan for your time and your expertise and your presentations.